The next case here, we have a 9-year-old boy with an underbite and crowding both the upper and lower teeth. Here we will be pushing his upper jaw forwards as well as expanding and creating some space for his lower left first premolar.
Now we are looking at something a little bit more complex, and we're going to use a variety of methods in order to push both the jaws and the teeth into the right place.
With early treatment here, we are not going to be only correcting his bite but also making room for the lower first premolar that's trapped, and along with that we're going to correct the lower dental midline back to its proper position. Here in this image you can see there is a picture of the child from the side and his x-ray that has been superimposed on. From this image we can see how the child bites edge to edge, which means his upper and lower teeth are touching each other right in the front.
So while we are pushing the upper jaws into the right position, as you can see from that there is a problem in the previous x-ray, we'll be recreating space for that lower left first premolar and pushing the midline back into the right place, and we're doing this early, and we'll soon see what the results of that is.
So as we can see here on the images side by side, the child's bite has improved and he has also shown some improvements in his mid-face as well. And in these pictures here we can see how his bite has improved, his upper and lower dental center lines are correct, and there's more than enough room now for the premolar to come through. It is no longer stuck.
So as we can see here, rearranging room for permanent teeth is important in reducing the severity of the problem. So as you can see, we have sort of pasted or superimposed the x-ray of that tooth before it came through the mouth, just to show you how it all works together. And you can see in the final photo that the x-ray of the tooth and the actual tooth itself has emerged successfully and into a relatively good position in the mouth. Not perfect, but good, acceptable enough. Yeah.
These few cases here have shown us the beauty of interceptive orthodontics and also the ability to avoid having more severe treatment later on. This process can also be called growth modification. Now moving on, let's see an example of a child here with severe crowding. What this means is there's way too many teeth and not as much space. So here we can see different methods of doing things. We can put on an appliance that is banded, which means it's fixed on inside the mouth, and with the help of this we can create some expansion to allow room to fit all these teeth in, alongside some extractions as well. The next thing we'd like to talk about is cross bites. So what is cross bites? It is when your upper and lower teeth don't meet each other in the proper way. So what we can do here as part of interceptive orthodontics is we can gently guide the jaws into its correct position with the help of a blend of treatment methods here at Dr. Face and Jaw. Here's another example of a patient who chose to not have any treatment done with the teeth in this position. You can see the tooth that has been circled in red. That is a tooth that is in cross bite, alright? With the amount of forces during biting and chewing that the patient has had over time, the tooth has weakened and has been pushed out of bone, ultimately leading it to be extracted. So the tooth has been lost.
Newer digital tools such as white smile clear aligners can be used to intercept these problems, pushing the teeth into their proper positions and preventing problems from developing later on in life.
Here's a picture, or a few pictures of a child who had a similar problem. He has one tooth in cross bite, so you can see from the photographs there's one tooth that is sticking out, the lower tooth, which should have been under the upper teeth. With interceptive treatment with white smile clear aligners, we have successfully brought the lower teeth into alignment and tucked them behind the upper teeth, alleviating the need for treatment later on in life.
However, sometimes you may have cross bites due to a mismatch in jaw size. The easiest way to see this is to have a look at the teeth, and if you notice that a whole group of teeth are in a cross bite or in an inappropriate alignment with the upper arch, then this is most likely due to a discrepancy between the upper and the lower jaw, or between the lower and the upper jaw. So in this case, the upper jaw is a little bit behind the lower jaw, and the upper midface is kind of dished in a little bit. So by pushing the upper jaw forwards, it will not only correct the bite, but also affect the deficiency or correct the deficiency in the midface area. By intervening early, this is called interceptive growth modification.